How to help during the coronavirus pandemic. The pandemic has upended daily life. As we approach the holidays, here are ways you can help others. The US is seeing an alarming new surge in coronavirus cases, with the number of hospitalizations shattering records across the country. About 26 million people say they don't have enough to eat as the pandemic worsens. Congress has stalled on its efforts to deliver another stimulus package, and as many as 12 million Americans could lose their unemployment benefits before the new year. As we approach the holidays, here are ways you can help. One of the best ways you can help is to reduce the spread of the coronavirus, and that largely means staying home and limiting travel. On November 19th, the Centers for Disease Control and Prevention issued guidance discouraging holiday travel, encouraging virtual celebrations or gathering only with those in your own household. If you still decide to travel or host a gathering with people who live outside your home, read our tips on how to celebrate as safely as possible. If you're starting to do some holiday shopping, the CDC also recommends shopping online, rather than in person, or using contactless services such as curbside pickup. Local and national non-profits are struggling to meet clients' needs. The coronavirus has continued to force layoffs and closures, as well as the cancellation of fundraising events. Here are some non-profits that would welcome donations. The pandemic and busy holiday season complicate blood donation, so the organization is encouraging healthy individuals to donate. It is particularly seeking COVID-19 survivors to donate blood for use in antibody and convalescent plasma treatments that can help those fighting COVID-19.
And we're paired up in teams. We get our gloves, we get our masks, sanitizer, and the forms that we need to fill. Then we take our cars or we Uber to these addresses and start knocking on the doors to see how people are doing. We try to talk to them, get as much information about their needs, about what they're missing, and try to have some conversation with them just to give them some emotional care and support. I have been a volunteer with the Red Cross for a little bit over a year. I just recently finished my master's in international development. I'm very interested in humanitarian action and human rights. Alors tu habites seule?
Oui.
Ok. Et tu as de la nourriture et les médications que tu as besoin? Ok. Tu as des autres? Just very fulfilling to see that I'm able to help people who otherwise cannot get that access to help. So I think that's why I'm interested in humanitarian action and human rights, because a lot of people have needs that are not met and they don't know how to meet them. They don't know the resources available. So sometimes I think it's important for us to take initiative to seek those who need help. I think it comes down to that.
Hello, we're from the Canadian Red Cross. Hi, hello sir, how are you doing?
I don't know English.
普通话。
中国话。
中国话。
我会说Mandarin。
Mandarin 很好很好。你好先生，我们是红十字会的，然后这里是那个就是 Ottawa Community Housing， 就是市政府要求我们来看一下您是否 OK， 您是否还可以。好，洋洋，好不好
？OK。
好的，
谢谢。
好
Thank you very much.
So they don't speak English at all. They all speak Mandarin, so they're Mandarin speakers. So I told them that if they need anything, they just call 211. I also give them this number here, the Human Needs Task Force number here.
Brings together community-based and independent blood centers across the country. You can use its website to find and schedule an appointment to make a blood donation in your area. raises funds to provide groceries to kids participating in its more than 2,500 clubs, plus virtual academic support such as digital activities and learning opportunities. 12 companies, including Forever 21, Neiman Marcus and Square Medical Supplies, have partnered with the organization for the holiday season and will donate a portion of proceeds. Supports the critical health protection work of the Centers for Disease Control and Prevention. It is raising emergency response funds through the Crush COVID campaign to tackle health equity issues, support frontline responders and promote education campaigns about the importance of protective behaviors such as mask wearing and social distancing. The organization's COVID-19 Response Fund supports non-profit organizations working in areas identified as having high numbers of affected individuals and those working with the most vulnerable populations. Areas of emphasis include helping healthcare workers with purchases of masks, gowns, gloves and other protective equipment, supporting quarantined and vulnerable individuals, and hygiene promotion campaigns to limit the spread of the virus. Focuses on safeguarding visual artists' livelihoods. Its COVID-19 relief grant program is a safety net for artists facing severe financial circumstances because of the pandemic. Until the end of the year, Surf+'s annual appeal fundraiser is raising funds for its ongoing work to provide help when unexpected emergencies, such as illness, injury or theft. An anonymous donor will match gifts up to $250,000. Works in the United States and internationally to equip doctors and nurses with life-saving medical resources. As cases continue to spike, the organization is delivering protective masks, exam gloves and isolation gowns to healthcare facilities in especially hard-hit areas. Donations to its COVID-19 Response Fund help food banks across the country support the most vulnerable communities affected by the pandemic. Shop at brands such as Crate and Barrel, T-Mobile and the Fresh Market during the holiday season, and a portion of proceeds will be donated. Works with thousands of partner agencies across the country including food pantries, shelters, soup kitchens and churches. The No Hunger Holidays campaign will partner with local groups to distribute 1.2 million meals to families in need. Each family receives a 25-pound box of food and 15-pound box of personal care items, plus additional items such as books and toys. Some distribution centers may offer in-person volunteer opportunities based on local coronavirus guidelines. The organization, which helps asylum seekers being held in refugee camps at the border and in U.S. detention centers, launched a COVID-19 small business remote legal clinic to help local businesses dealing with legal issues or seeking grants and loans during the pandemic. Since April, the organization has aided more than 1,500 small businesses and non-profits, and it is preparing to help them navigate additional congressional relief, if it's approved. Deploys funds to ensure access to free meals continues for children in need, especially with schools closed. Brands such as City, Nutella and Madwell are offering promotions and seasonal gifts, with portions of proceeds going to the organization. You can also buy holiday cards. Cities and states have imposed new restrictions on businesses and restaurants, such as reducing the number of hours they can stay open and how many people they can serve. Support your favorite local restaurants by ordering takeout or buying a gift card to use for when you can return safely. If you want to support servers and other workers, you can also donate to non-profits such as the Restaurant Workers Community Foundation, which has set up a COVID-19 relief fund assisting restaurants and their workers. Another non-profit, Children of Restaurant Employees also provides assistance to employees who have gotten sick with coronavirus, while still having to care for their children. Some advice stressed at the start of the pandemic remains true. Keep washing your hands with soap and water, try to avoid touching your face and practice social distancing. Wearing a mask in public also remains important. The CDC said last month that wearing a mask protects the person wearing a mask and others around them. Wearing a mask blocks you from inhaling potential virus-containing particles in the air. John Brooks, Chief Medical Officer for the CDC's coronavirus response, told The Washington Post. But most of the benefit to a mask is to block particles coming out of people who don't know they are infected from exposing others. Health officials are also urging people to get vaccinated against the flu to avoid overwhelming hospitals and medical offices with people ill from the coronavirus and influenza. As families in the DC area continue to struggle with unemployment and evictions, winter is expected to push households into even more difficult circumstances. Several non-profits ramped up efforts to help at the start of the pandemic in March, but many report that need is higher than ever. But donations and volunteerism are down. Provides meals for the homeless and has been distributing hand wipes and provided sanitizing stations throughout the community. The group is accepting donations for clients and residents who may become ill. A list of needed medicine, food and household items is available here. Donations can be dropped off at 71O Street Northwest from 8 a.m. to 4 p.m. on weekdays and 7 a.m. to 2 p.m. on weekends. Monetary donations are accepted online. For updates on the organization's response to COVID-19, holiday giving opportunities are also available, including a toy drive and collection of shoebox gifts that include basic hygiene supplies. Offers thousands of breakfasts and lunches to DC youth every week at various locations throughout the city. Central Kitchen has also ramped up meal deliveries to shelters and non-profits, working with communities disproportionately impacted by the coronavirus. According to the group's COVID-19 Impact Dashboard, it has distributed more than 2.4 million meals to children, family and seniors. DC Central Kitchen accepts donations online.
The restaurant hospitality business in the greater DC area before I joined the kitchen. We want people to think of the work, understand the work that we do is really about economic development, economic inclusion, and creating better communities. It's not charity. We're training men and women who are coming out of prison in recovery from addiction, folks that have been victims of abuse, have been unemployed, chronically homeless. Train them so that they will be able to find employment and careers in the hospitality business.
I just joined the culinary job training team, and I'm training right now with my supervisors to teach the culinary class. I've been cooking most of my life since I was a teenager. I'm known around here for my kale salad. When I got here in 2011, I was out of work for almost 3 years. When you first come on board, you're like, this is impossible. You need 100 people to put out 5,000 meals, but I've seen 10 people put out 5,000 meals. You see, the reality of how it can be done. The first few weeks is a little scary because you think you're coming to cook, and the job training program really prepares you for life skills. We have a workforce development team that teaches us how to write resumes, and we do mock interviews. The training program really gives you some insight into what it is to be a professional.
Helps women overcome homelessness and addiction and offers showers, meals and places for clients to do laundry. Appointments are needed to make drop-off donations, with some restrictions, between 1 p.m. to 4 p.m. Mondays and 9 a.m. to 1 p.m. Thursdays. The non-profit has been delivering digital educational content to families along with access to diapers, formula, wipes and grocery gift cards. Martha's Table is also partnering with local schools and the Capital Area Food Bank to provide students groceries at designated sites. It has reported a 400% increase in the number of neighbors needing access to food because of the pandemic. Volunteers, who will be asked to follow a coronavirus health policy, can prepare food and bag groceries.
Markets again in that pre-bagged bag and go model throughout Ward 8. We have pop-up markets Monday through Thursday where people are able to come and get groceries. We also support several senior buildings where we know that seniors have obviously been encouraged not to come out, and so we have been going there to drop off groceries. Once all of the COVID-19 started, we actually changed our model to a pre-bagged model. So now, instead of people coming into a confined space and shopping for groceries, we actually bag thousands of groceries a day so that it can be a bag and go model. Now, when people come on a nice day like today, we're set up outside, people come up, they pick up their bag, they go, or we drop it in your car, you come and you go. It's very immediate. We already had a partnership with the DC Diaper Bank. If they're already coming here for food, then they should be able to get diapers and wipes as well. And so on Mondays and Fridays, when our bag and go model is open, we also have diapers that are available. In addition to our grocery programs, we've also now launched a partnership with Clyde's Restaurant Group and Need Hospitality, where we're doing hot meals. So 400 hot meals are going out again to senior buildings. So far, we are able to respond to the growing demand. We know that it's going to continue to increase. What we're hearing now is, you know, I just lost my job, or my hours got cut, or this was the first time I didn't get a paycheck. So we believe that the demand is going to continue to increase, and we're going to continue to stand alongside the community as long as possible. If demand continues to grow, we're going to have to continue to look at different ways to modify the logistics and the operations. We have seen a decrease in volunteers. The entire team is on mandatory telework, so our people power has dropped significantly when, again, more and more food is coming in, and so we would just continue to change logistics and operations to try and meet the demand. I mean, I don't know what the breaking point is. I'm sure there is one out there, but we hope that we never get to learn what it is.
This morning, the U.S. now surpassing 19 million cases of the coronavirus, adding more than 1 million new infections in less than a week.
This is the worst stage of the pandemic, and we've got to get through this. And the only way we're going to get through this is if we're all working hard to take precautions.
But Americans don't seem to be listening, ignoring pleas to stay home. More than 8 million people flew for the holiday, marking the busiest travel period since the pandemic began.
We faced a surge in April, surge in August, and now we've got this third surge that is the worst. And we don't know what this looks like yet.
In the UK, where a more contagious strain of the virus is running rampant, travelers to the U.S. facing new restrictions starting Monday. They must show a negative test within 3 days of boarding their flights. In Los Angeles, where a person dies from COVID every 10 minutes, testing for the highly contagious strain in the UK has already begun. Fears that it may already be here and contributing to the surge. But experts are hopeful that the vaccine, currently being administered worldwide, will work against COVID mutations.
I think it's probably more likely that the current vaccines are going to be protective against, a wide variety of different strains.